Children are innocent and do not participate in their parents' criminal activity, and in spite of rising awareness of various health risks, it is very prevalent in India for women to abandon their unborn children if they become pregnant before getting married. She may not want this baby because she has other children already. She has the option to freely place the child for adoption. When a woman is unable to provide for her kids fully, she may abandon them. She either feels incapable of doing it physically, psychologically, or both, or she wants to provide the kids a better life than she can give them on her own. There are mothers who have been raped or who didn't want the children in the first place. They must be feeling guilty, humiliated, and perhaps even regret. On the other side, people might have a sense of relief and hope. It would undoubtedly be difficult for a child to feel abandoned. We don't comprehend why a woman would do this. God, however, always has a plan. Due to their child's injuries, the parents of a newborn who had horrible burns shortly after birth ruthlessly abandoned him. On November 16, 2014, Mate Zerko was born in Chalav, Russia, which is 2 hours south of Moscow. The man was a happy and healthy, but he did have a mild case of jaundice. His doctors recommended light therapy, which required him to spend small periods of time lying under a specific lamp. The infant departed under a UV light. This worst-case scenario is a living nightmare for one couple in Moscow. The events that followed after they brought their infant in for routine therapy to address his jaundice caused them to lose faith in hospitals. Meet Matvey Zarenko, a Russian native of Chalav. Moscow may be reached by automobile in only 2 hours from the city. Matthew's parents were overjoyed to have him in their lives since he was a joyful boy who loved to grin. Then one day, the child fell ill severely, so they hurried him to a hospital close by, but neither of them realized at the moment that their lives, as well as the life of their child, would be forever changed. Matvey had developed yellow skin. This, however, is a pretty typical sign of hypoglycemia, which can occur in babies. The abnormal buildup of bilirubin, a chemical present in the blood, is what causes the skin to turn yellow. Jaundice, it turned out to be an unexpected sickness with some equally unexpected side consequences that had a profound impact on her life. But neither the nurses nor his parents were able to foretell the child's fate. In fact, it happens so frequently that Western doctors check newborns 5 days after birth to be sure they haven't acquired it. However, the reason for the jaunt is that their little bodies haven't yet found out how to get rid of all the money from Aruba from their systems. Up until this point, they were cared for while still in their mother's womb by the placenta. The issue was minor at first. In the majority of such situations, there is no need for medical intervention. In reality, a week passes before the symptoms that surface within the first 5 days following birth. This is due to the fact that the baby's body eventually develops the capacity to handle the bilirubin present in their system on its own. The jaundice persisted in Matthew's case, though. It actually worsened significantly, which was a warning of prospective problems. For Matvey, however, this was just the beginning. In addition to the child's family medical history, Matvey's doctors performed a basic physical examination and spoke with the parents about their overall health as well as the health of their infant. The physician determined Matvey's blood type to be different from that of his parents. The doctor was concerned about the findings, which prompted him to decide how to treat the youngster. But this decision ultimately had unexpected effects on Matvey's life. Matvey underwent a typical procedure. UV treatment is frequently recommended for infants with jaundice. The method uses phototherapy, which is the application of UV radiation to the youngster. Although it might sound easy, you can't just leave your youngster outside to enjoy the sunshine. Naturally, Matvey's parents trusted the hospital to decide what would happen to their son. After all, the day that everything went wrong, there was nothing to suggest that a routine therapy may have uncommon side effects. UV light therapy necessitates ongoing oversight. However, Matvey's parents decided to let their kid have the treatment because they weren't concerned. They were unaware that something was about to drastically fail. On Monday, 2 terrible things happened. First of all, the hospital nurse who had been watching the infant closely left the room, which wasn't supposed to happen at all. The UV bulb then exploded next to unfortunate Matvey while the nurse was away. The nurse was appalled when she entered the room again. When the UV bulb blew up, Matvey was completely enveloped in flames. The nurses did their utmost to put out the fire even though the child's flesh was starting to fall apart. Matvi had sustained terrible burns all over his tiny body by the time he was safe. While the nurse might not have prevented the lamp explosion, she could have been able to rescue the youngster from needless agony. He had severe burns. Small burns can hurt, but big burns, like the ones you could get, hurt a lot and take a long time to recover. Sometimes they even pose a threat to life. People who have had significant body burns are typically more prone to sickness and death. It therefore appeared that Matve was facing the battle of his young life, and the hospital would have to do whatever it takes to preserve the child's survival, including trying to accomplish a miracle if feasible. Given that Matvi had second and third degree burns, he was in excruciating pain. He had lost his appearance for good. Despite the UV lamp explosion leaving Matthew permanently scarred and disfigured, he is not in immediate danger. Fortunately, the hospital was able to attend to his wounds enough that the infant would live. Unfortunately, Matvi's natural appearance can never entirely be recovered, even with plastic surgery, which will be a continuous process. But regrettably, this isn't the worst news the youngster has ever had to hear. His parents ignored him and turned away, as if being roasted alive by a UV lamp explosion wasn't frightening enough. Maddie had to handle yet another tragic situation. As a result, while he was in the burn unit as a result of the pain, Matvi's parents left his life and disappeared. Matvi need ongoing care. Matvi still requires numerous treatments even though the hospital was able to stabilize his condition. Sadly, the child's body was charred to 70% of its original size, including some of his internal organs. Although the life-saving emergency surgery was performed on him, he still has a long way to go and will have a difficult time returning to a regular life.